Hi, happy Friday, everybody. Welcome to our Friday Remaking Medicine Practice of Imagination, where we are going to occasionally talk to artists and healthcare experts and change makers and do that hard work of working on our imagination, our creativity, and our hope for the future of healthcare, all related, of course, to the book Artists Remaking Medicine, which is available now for sale. So this week I have the amazing Roshni here with me, who I recently, like a couple months ago, met at an event for creatives, and who is a nurse and is just like such a wonderful leader who is educating more nurses about how to be leaders and who's really working on balance and sustainability in her own career. So thank you so much for being with us today.
Hi, thank you for having me, Emily.
Yeah. So do you want to introduce yourself a little bit more elegantly than I just did?
Yeah, no, it was perfect. I think the beautiful thing is that we wear many hats, and I think it's
Mhm.
important to remember that. So yes, I am a nurse. I also work as a coach and advisor. I teach graduate nursing students that are invested in community service projects. And I think the common thread through all my projects that I work on, both personal, professional, spiritual, is this lens of creativity, this childlike curiosity that I carry with me in everything. Right, I'm a lifelong learner. I'm currently building a nonprofit from the ground up, just a baby seed side project, and I think that comes from experiences of asking questions and answering curiosities in all the roles I get to play in my life, both as a caretaker at home and a caretaker in my
Mm.
professional setting. And I just think it's important for us to have these dynamic roles be recognized. We're not just one profession anymore, so we're all carrying our whole selves into our jobs.
So in the book, I interviewed the critical care nurse turned
Mm-hmm.
world famous artist, Nate Lewis, and he talked about how for him, one of the biggest crossovers between art and nursing was that practice of assessment, of
Mm-hmm.
really being trained to look at something and evaluate, or someone, right? And evaluate what is happening with that person, what is happening in this situation. And he felt that that was a really like such a strong kind of crossover between art and his clinical practice. So I would wonder, like, from your perspective, what are the places that nursing really fosters creativity, and then
Yeah.
also what are the ways that it maybe diminishes that or discourages that in
Yeah.
practice?
So I think I became a nurse as a second career. And part of that drive was to find alignment in my work that was aligning my head, hands, heart, is what I say. Like, I want my values to be
Mm.
aligned in the work I'm doing day in, day out. And I realized, part of me always wanted to be a Oprah like journalist. And so the
Oh,
storytelling component of patient care is what I love, right? I love, when you're in critical care nursing, you have the same patient and their families for, sometimes weeks, sometimes months. I used to work as a nurse assistant with the brain injury patients. So I would have brain injury patients for months, right? Watching their progress really
mhm.
slowly. And a hospital setting, as a patient, you become this diagnostic entity, right? You're like patient XYZ in this room, and doctors are rounding on you, and you become this disease state.
Mm.
Um, I was a caretaker for my mom for the past, before she passed away, for the past decade, and it drove me nuts to see her diminished, right? This whole vibrant human being diminished into this diagnostic
Mm.
entity. And so I carry that wisdom into my nursing roles. And what I love the most about nursing is when I'm able to know my patients, not just assess them physically, their lab values and their, clinical diagnostics, but looking at them big picture. Who are they? What is their quality of life? What is their access to resources outside of the hospital?
Mm.
What do they care about? Who do they matter to? Right. And I think when I can have time to do that with patients, um, it's what I love about nursing is I just get like I have an abundance of stories in my head. I get so much wisdom from my patients. I call patient care therapy because in all my spaces of grief, patients have given me, they've taken care of my heart. And, I have a mom, and I'll take care of a mom that reminds me of my mom, and she'll give me wisdom without even knowing it, right? Or going through a heartbreak or romantic heartbreak and having a patient telling me about how boys don't matter, right? It's just like little things like that, leaving me love notes. Or there's such a vulnerability. And when you're bathing a patient, one of my favorite acts of service is to bathe a patient and really give them that sense of humanity in that such a vulnerable space,
Mhm.
because it can be a diagnostic task. I am exhausted. I am in a rush. I do need to get labs and do this and do that. And it's not important care, right? It's not vital to
Mhm.
their well-being, but it's vital to their soul being, right? That's where my creative practice cuts to come in, is how do I make this person feel more beautiful? And how do I get the questions and answers I care about? And the reality is that we work in a healthcare system that doesn't always allow that. You know, I'm
Mhm.
crunched for time. I can only give so much and pour out to others without burning out myself. Um, we're working under high stress, short staffing. You know, I've shifted from critical care into a more acute care setting, but it's still this sense of like, get the patient out, next bed, next bed, next bed,
Mhm.
versus this like human experience. And that suppresses my creativity, right? You can't be creativity in itself can't be finite and in a timeline, for me at least. My experience is that it has to be experienced, and you have to have blank space for it to be experienced, right? Like as kids in recess. And so yeah, I almost wish there was like a recess for healthcare workers in our shifts to like go
Oh, I
play.
love that idea.
And like, yeah, I'm like, how do
Yeah.
I create this culture of like, yes, we have lunch breaks, but can we have a recess break to like just go play and go,
Yeah.
yeah, marinate in
Yeah.
that space?
Is there anything that gets close to that even? Like where you get to, because your break is really for you personally, it's not for you to go
Yeah,
and talk with other
my break
people.
is for me to scarf down food and
Yeah.
get a walk in or a workout in. I think there's a camaraderie depending on who you're working with that we
Mhm.
build that in. But there is, and you know, I work as a travel nurse, so I've been across systems, I've been across
Mhm.
cultures, and there's this common thread across cities that I see, that like there's this crunchiness that happens where staff, you know, I love my coworkers. Why I come to work for my coworkers, because you have the good ones, and it's almost like a shared trauma experience,
Mm, mhm.
but we're all kind of like hiding parts of ourselves from each other and from management, because there's not the space to be expansive. And I see that with my students too, right? Like there's this space that they have to bring forward to me, and I'm like, I want you to. We can't heal humans if we're going to hide our own humanity. You know, like there. The truth is that we are all going through our own pain and suffering, and there should be some space to process that together. And I think then that fosters a space for, you know, kind of navigating how to make that something that's beautiful to share with someone else, right? The
Yeah.
best healers are the ones that have their own experiences with pain, I think.
Yeah.
So when you can tap into that, I think it's just amazing. Just hard to find space for that all the time.
It
Yeah.
really stands out to me of one of my own experiences of being in the hospital that I remember of all the, like, amazing, beautiful, terrible, horrible things that happened to me when I was
Yeah.
a patient. I remember that there was a nurse who came in and she was like, "I haven't done this procedure before." I was like, "We'll figure it out together. Like, we'll work it
Yeah.
out together." And we had like a good time, like thinking about how to do it and like what was going to happen. And like, I feel like it was such a great kind of collaboration with me and this
Yeah.
nurse. It was probably like 10 minutes, right? But it really stands out to me of like, oh, she was being really real about, vulnerable, that, this is not something that she had done like 100 times before,
Yeah.
and like it made a really nice relationship with me where I felt like as a patient I could help her, right?
Yeah.
And it was just so beautiful, and like you don't always get those kinds of moments, right? When
Yeah.
you don't have space for those necessarily all the
Yeah.
time. Yeah.
And I think sometimes it's just a reminder that we're all figuring things out. So,
Mhm.
you know, I always tell students, like, tell someone you're a student. You don't have to be an expert, right? And I still, and the more I work in healthcare, there's things I'm like, oh, I should Google how to do this. Like, I don't remember. You learned it like 10 years ago, you forget about it. And it's having that humanity with the patient, being like, listen, like, I'm going to figure this out. You know, I want to help you, but
Yeah.
I don't know. I don't know your insurance. I don't know the issues that you're having. I don't know your home opportunity, you
Yeah.
know, what access things to things you have. And um, it's little things too, right? Like giving a patient paper and pen to draw in color. Like it's just like there's
Yeah.
ways to make them feel a sense of control in a situation where they have such little control.
Oh, for me,
Um,
it was, being able to order my meals on the TV with the remote.
yeah,
That was
nice.
like I became intensely focused that I was gonna be like the
Yeah,
best meal orderer that this hospital had ever seen, and
yeah,
that was so emotionally important to me to have something that I felt like I could do or contribute right in the
Yeah,
hospital. And when I
of course.
actually met that company at a conference, you know, the guys who I talked to, they like completely did not understand what I was talking about. When I was like, this was super emotionally important to me in the hospital, like your
Yeah.
technology. And they're like, okay, like, sure, weird lady, like, bye.
Yeah. And that's why I think it's so important for people who work in healthcare. Like I
Mhm,
advocate for nurses and myself also to be in spaces of technology and innovation, because
mhm,
we are the conduit that between the patient care and the access to like what technology, the impact it has. And
mhm.
I think it's such a beautiful space to share your expertise and also share the impact. Because you're right, the people that are creating this have no concept of what's happening. But I'm like, I
Mhm,
see the impact it has
mhm,
and how to make it easier, or how to make it more, that is also creativity, is how to see what exists and like adapt it to what makes sense for the situation, right? There's so many ways that that lens can be viewed. And healthcare is innately a creative field that I think doesn't get credited for being a creative field.
mhm.
The amount of ways that we use equipment inappropriately to make things work for us, because you're short of resources, like we're gonna make it
Mhm.
work, and so I learned from amazingly brilliant nurses, and I'm a huge advocate for nursing because I just feel like I've learned so much from nurses. I became a nurse because I was inspired by nurses. I'm not knocking other professions in the healthcare field,
Yeah.
but I do think that there are some incredible human beings that I'm lucky enough to call my coworkers and counterparts. So
Oh,
yeah,
I love it. I mean, it's just really rich, the text that you're sharing around, you know, being a storyteller, being somebody who's like an inventor or like a sculptor who's making these devices out of, you
mm-hmm.
know, like medical tape and like pipe cleaners. There's so many different ways that creativity is really so woven into nursing. It's so beautiful.
Yeah, it really is.
And so tell me about for your own professional life,
Mm-hmm.
what are ways that you really make sure that you have space for creativity or that you have space for just like a sustainable career? And then
Yeah,
I want to talk about your work with students and what you're doing to inspire other people.
yeah. I think
Mm.
um, I will say that I wasn't always great at taking care of myself, because I think you get lost in this act of service, and service and sacrifice can be really closely. They're on the same. There's a very close connection
Mhm.
there. It's hard to set the boundary sometimes. I think the pandemic kind of forced me to be in a space of surrender for the first time in my life, to say no, to
Mhm.
not be able to be just going, because I still think I have some PTSD from the amount of suffering and death and trauma, and
Mm.
because people are still getting sick, people are still getting shot. I was in Chicago. There's still the same things happening, but then there's like this inordinate amount of suffering that I have no control over happening. So I think the pandemic really sparked this space of pause for me. I lost my mom during the pandemic.
Mm.
I think that that space of grief really brought me back into like my childhood self of needing a creative outlet. And so
Mhm.
I just found myself writing a lot. And I, at some point, want to make this into a book, because there's just like bits of writing everywhere. And I was so lucky to have such a close relationship with my mom. I think the one benefit of having someone you love be sick for a long time is that the way you look at time really
Mm.
shifts. And so my mom and I were able to have very intentional, beautiful dialogue about life, because we felt the finiteness of the time, right? And so there was the space of like really letting go of all these appropriate, boundaries, and just really getting to learn who she was as a woman, as a daughter, as a wife, as a whole being. And I think that in the process of me unpacking my own
Mm.
experiences as a healthcare provider, right? It's I became a caretaker for my dad. I was kind of caretaking in all the roles in my life. And it's like you unpack those layers of yourself. And I found myself coming back to knitting, cooking, crocheting, these are really simple, like
Mm.
tangible, controllable things that I felt I used to sew as a kid. I've always been a scrapbooker. I've always been this like creative person, and I let a lot of that go as I became older.
Mm.
And I found myself kind of reverting back to it. And now I do a lot of dance. Like dance is one of the first things I went back into in my sadness, is to move and listen to music. I'm not good at any of these things, right? But it's just like what I enjoy, where I feel the most alive. And so I think what I've been doing now is I'm like trickling back into the workforce is one, I don't define myself by my career. I am a nurse. It's part of what I do. I love when I get to serve in that role, but I do not equate my life purpose with my job. You know, it's a job and it's also meant to be it's a source that's supposed to help me, fund other dreams and ideas, but it's not necessarily the healing or the care that I want to define who I am. So that's why I started my coaching and consulting practice and kind of figuring out what that looks like slowly and um, finding space for creativity is being around people, going into spaces and workshops where I am exposed to new ways of thinking, really just allowing myself to be curious and just explore things without repercussion, right? I'm just really just trying things out and being like, okay, this is being okay with failure is basically my
Mm,
MO in life is like, there's no such thing as failure if you learn from it. And so
mm.
how can I constantly let myself be a learner and feed into this part of myself and make things out of something? And, the pandemic gave me a catalyst to do the storytelling fellowship with that allowed me to interview other healthcare providers and just really get an insight into how many people have stories that they're dying, really itching to tell, yearning to share, but they don't feel like they have the value and worthiness to do so. And
Yeah.
so it's kind of my next experiment is like, how do I create safe spaces for people who don't define themselves as creatives or define themselves as worthy of telling a story? Those are the stories that I find most valuable to hear, And so, those are kind of the questions I'm like kind of pondering at the moment.
Well, that really stood out to me when you invited me to come speak to your graduate student nurses.
Yeah,
It was incredible conversation, and I was really taken at the end of just the not even reluctance, but just, like, sort of the sense of impossibility that people felt of, like, "You mean I could write, like, a letter to the editor in the newspaper?
yeah,
Like, I could speak up and do something and share my insights and share what I'm advocating for as a nurse." Do you think that's a part of the kind of professional culture of nursing? Or is that just, I mean,
yeah.
is that all of us feeling kind of powerless in this modern world?
Yeah, I think there's this sense of fear when you're a new nurse or a student. Like you feel like you have to be an expert. I think as women, we carry a lot of imposter syndrome, not all around all of us, but there's a sense
Mhm.
of like, I have to earn this right to be able to speak up. And, I tell patients, like, you are your number one advocate. Like, I owe it to my
Mhm.
patients. Like, you are the CEO of you. This is an opportunity for you to know your body and know your intuition. And you tell me, like, I am not the expert of, you can't come here and say, you to figure it out, right? We have to work together, but you have to tell me what you're thinking, what your gut is telling you. And I tell this to students, like part of nursing school, a lot of my students are second career nurses or it's a very intentional choice to be a nurse.
Mhm.
And they're living in a culture and a time where there's a narrative around what nursing is.
Mm.
And the reality is you're going into a system that does not work. Like it is broken. And the reason why it's broken is people who have ideas or solutions are too scared to speak up. So we
Mhm.
have to learn to be, unfortunately or fortunately, not only learning the skills to be a efficient nurse and care provider, but also to be leaders and to also be managers and change makers. And I think anyone that's in med school or nursing school will tell you it is not fun. Like we don't have
Mhm.
proms and happy hours and like we're on exams. I mean, I was in nursing school. We had exams every 3 days. You can only get 4 questions wrong per exam. It is high stress, high intense, as it should be.
Yeah.
But when you have that kind of rigid culture ingrained,
Yeah.
there's so much fear of failure, right? You make a mistake, someone's dying. That when you're taught that over and over and over again, it paralyzes you from taking risks.
Yeah.
And so I think for my students and for myself as a reminder, my coworkers, I remind like mistakes are inevitable. We're gonna make mistakes.
Yeah.
We unfortunately some are gonna cost more than others, and that is just the culture of our profession. And
Yeah.
but that shouldn't be the inhibitor to us making change, right? I mean, it shouldn't be. We're noticing things differently. We're experiencing inefficiencies, and so I guess my hope is that just by empowering people to slowly speak up appropriately, right? They don't need to bash and be angry, but like, hey, like I can write an op-ed piece about this, or hey, I can join the American Nurses Association and speak about this issue or speak about nurse bullying or speak about what makes me fearful. And that, by the way, will carry into my personal life, which will carry into my professional life. Like I always tell students that if this profession isn't changing you internally, you're not doing it correctly, right? Because it should, you should be humbled by the work that you do, and you should be constantly growing and changing. And just like I'm a critical and I'm assessing and criticizing and looking at the patient care or the hospital situation, I'm also looking at my own healing in my own life and how am I choosing to spend my time? What am I focusing on? What am I diagnosing about my own dynamics, right? Because it has to be kind of symbiosis. It has to have kind of happen there. So yeah,
Yeah.
I think that's really cool for my students. They do a lot of community service projects, and they get to kind of see how the nurse's hat can be worn in different ways in the community. Um, the weight of that title, what it means. You don't just clock in and clock out and you're done. Like people look at nurses as a resource for their communities, and
Yeah.
especially with the environment now, with AI, with all these areas, nursing plays a role, healthcare plays a role. And so I hope that that empowers people to see themselves as a
Love that.
powerful change agent.
I mean, shout out always to the book that I'm obsessed with, which
Yeah.
is called Taking Care by Sarah de Gregorio, which is an incredible look at nurses, exactly like you said, of being, really powerful caretakers across communities, not just in a exam room or not just in a surgical, theater, or not just in a hospital, but really, like the playground was invented by a nurse, right?
Oh
And
wow,
like
cool. Yeah.
all this like really incredible rich history that nurses don't always necessarily get credit for. I'm really curious, like that parallel that you spoke about in medical education between what, student doctors go through and student nurses. At least on the physician side, there's a couple moments of joy that are kind of built into that. So today is actually match day. And
Yeah.
social media is full of all these like amazing, joyful moments of future doctors being really excited to get their placements and opening up these envelopes. And there's a bit of like a fun, joyful moment built in. And then, of
Mm-hmm.
course, the white coat ceremony, right, which is a big moment of transformation for people as they are on their way towards becoming a practicing physician, and which feels really, really old. But in discovering for the work for the book, it only was developed in the like mid 1980s as
Yeah.
a kind of
In
cultural
Chicago.
point,
Yeah.
right? In Chicago, exactly.
Yeah.
Are there ceremonies like that in nursing education?
Yeah. We have a pinning ceremony, which is our equivalent of the white coat.
Uh-huh.
Ours is kind of towards the end of the program, where you do an oath. We have an oath to patient care, and
Mhm.
yeah, and that's a huge deal.
Mhm.
Nursing students do get white coats. I
Mhm.
think that's also part of the culture of kind of professionalizing the system.
Yeah,
I think for my nursing students, the first time they put that stethoscope around their neck,
that's a
like
moment.
in an assessment,
Uh-huh.
I mean, it's not like it's a ceremony, but I think I see the shift in their like stance, kind of almost be
Yeah.
like, it feels official when you have that. And it's so beautiful to watch someone kind of like grow into their confidence or who they're going to become, right?
Yeah.
And yes, I think I have the privilege of really seeing an internal transformation, which is beautiful. And then yeah, externally we do have a pinning ceremony and a graduation ceremony, and and then nurses can get hooded once they get their doctorate. And so it is a whole structure,
Yeah.
um, and there's so many moments of joy. And I
Yeah.
think for doctors and nurses alike, if you ever stay at a bar post shift with anyone that works in healthcare, yes, we'll be ranting and raving, but there's also just like these like miracles, right? There's just these
Yeah.
moments that we're just like, we don't know what happens to our patients 10, 20 years from later, but it's like that intersection of time. It's just like this person has such a big part of your life, and they'll never know how much they meant to me, but it's
Yeah.
like, I remember them. I mean, I remember the baby I delivered for the first time. I remember the mom that came out of a coma and like got to go home. Do I know what happened? No, but like you
Yeah.
remember these moments and you're like, okay, like I made a little difference, baby difference, and it's like a really powerful feeling to experience and be part of that.
Yeah, that's so beautiful. Yeah, I feel the same way as from the patient side. I barely remember a lot of the physicians that I had, and of course, they were really important to my care and my stay, but I remember, like, so vividly all the nurses that I had during my
Yeah.
stay, people who really looked out for me and helped me out. It was just really an amazing experience in that way.
Yeah.
We only have a
I
couple more
also,
minutes. Oh, go ahead.
okay.
Sorry.
Yeah,
Yeah.
I wanted to just, because I really advocate for my care technicians, like all the PCTs and like the
Oh,
techs,
yeah.
the janitors, all the
Janitors.
staff that
Yeah.
I'm seeing. I just
Yeah.
want to say, like, as a nurse, like, I could be nowhere without them, and they're such a vital part of patient care as well. And they often
Mhm.
don't get recognized or they get overlooked or, and so yeah, I just want to, like, I always tell patients, I'm like, yes, we do work, and yes, we're all a team, but like, there are people here that are doing invisible
Yes.
labor that has such a huge heart, and they're showing up every
Infection
day. And
control, shout out.
yeah, all of them. So I'm just like, I'm a huge
Yeah.
advocate. I'm like, we're gonna celebrate my janitors because
Oh
they
my gosh,
do a
yeah.
really good job, and they're really just, yeah, just beautiful human beings coming to
I mean,
work.
anybody who stayed in the hospital for more than a couple days, I think develops the strategy that, like, yes, you're not feeling your best and, like, you're in a bad situation probably because 'cause you're in the hospital, but that, like, any emotional energy you can spend towards being kind to the
Yeah,
nurses and the staffs and the janitors, like, it just comes back, the karma comes back to you, like,
yeah,
tenfold all the time.
yeah.
Ah, that's so wonderful. Well, let's wrap up with our final question, which I think you've already touched upon a couple really amazing ideas related to this. But I like to just ask our guests, like, what's a healthcare utopia look like
Oh,
to you? And it doesn't have to be the entire system, but you can, zoom in and out however you
oh
want.
no, I have this
Yeah.
vision.
You're like, okay, good. All right, tell us the vision.
Yeah, if money was no object,
Mhm,
I feel like healthcare systems should look and feel like how we would at home, right? There should be windows and fresh plants and fresh
mhm,
food and gardens, and colors that are not gray. And I think, we have such a culture of, like, this grind, and I feel like we should give so much more autonomy to doctors and nurses to take time away,
mhm,
and still be supported financially. You know, it, like, I just see like that we're burning humans out of being humans, and I think we have to bring that back into healthcare. And I
mhm.
don't think it's easy to heal when there's so much beeping and like awkward lights and someone's exhausted. Like, I feel bad for my patients who get me on my day 4,
Yeah.
8 hour of my work, right? I'm just not energetic. I'm tired. And it's very little things like having fresh water or having free snacks in the break room. Like, it's just like we should be set up
Mhm.
like a tech company
Mhm.
for innovation, and like there should be a recess, a playground. There should be a break room that's silent and it has like coloring and drawing. I mean, just like a space for healing.
Yeah.
And I think if we centered healthcare not around money, which it is now, but around actual healing,
Mhm.
um, right? Like, the food we feed our staff and patients should be healthy, real, clean food. If we center healthcare in the community as part of a community resource and not this like business entity,
Mhm.
I really feel like it could shift the way we look at care, right? And because it does, our environment impacts it, our nutrition impact. There's so many factors that are part of it, and a lot of what we end up doing is so rote or like by standardized, which is
Mhm.
beautiful. It's good, but like, standardization has changed and they evolve to the person. And so, yeah, I envision, hospitals were first created by nurses, and so I envision a nurse or physician led healthcare system that's
Mhm.
innovative, healing, almost modeling like a school or a resource. Or like, it should be
Yeah,
attached to like a nursing home and a school and be part of the community. Like, it just needs to be built with more energy and lightness.
I love that. I was actually just myself playing with the idea around, like, what if a hospital was designed for sleep? Like, and just how different it would be, like, in the sound and the lighting and, like, the bed choices, and
Yeah.
just, like, that's
Like, if
just, like,
patients would
such
work
a
from
fun thing
home
to
and
even imagine, right?
yeah. And like, take your medications and also like, like, go to yoga. And like, do we need to do labs at 4 in the morning? Can
Oh,
we figure out which patient needs what labs when? Like, we're just doing them daily for what reason? Like, it's just like
yeah,
so much waste. I did my thesis in undergrad. Sorry, I know we're running on time. Was on the cost efficiency of hiring staff to like cook fresh food and wash dishes, and
yeah,
having patients wash their own dishes. Like, they can be part of the system, and like,
yeah,
we don't need to like have this like plastic. Yeah, I don't know. I have a
disposable
lot of. Someone hire me.
autonomy.
Whoever
Yeah.
has money, hire me. I have so many ideas to change.
Well, let's figure out a way. We're gonna get you some funding to build your own hospital. Let's
Yeah,
put it there in the
that's the
universe.
dream. Like,
Oh, this has been amazing. Such great ideas. I love the ideas of like the crayons, bringing almost like, like the kids drawing thing to a patient. I love the
Yeah.
idea of the recess. I love this idea of like a totally different hospital that's really open in the community. And it's just fantastic talking with you. I'm so grateful for
Yeah.
your time joining us today. And I hope, we've done a couple things together, and I think every time we end with like, let's do more, let's do more.
Yeah. I just love that I appreciate that as a patient, you took this and like saw the value and you're just creating such a beautiful space for, you know, people in healthcare are itching to share these stories and spaces. And so you're just doing an amazing job of creating that safe space. So thank you.
Oh, thank you. It's a love
Yeah.
fest. Happy Friday. Enjoy the
Happy Friday. Happy
sun.
match day, everyone. Yeah, it's
Happy
awesome.
match day to everybody. Take that energy, bottle it up, take it with you because you're going to need it
Yeah,
in the next
totally.
step of your medical
It's a good
education.
reminder of those moments. I
Yeah,
forget. You forget like your first IV. And I'm like, oh yeah, that was really exciting for one time. I
yeah,
forgot now.
yeah, exactly.
Yeah.
Well, thank you so much.
Thank you so much. Have a great
Really
Friday.
appreciate it. Thank you. All right, bye bye.
Thank you. Bye.